Hello, Carla Colella with Oconomowoc Physical Therapy coming at you from I don't even know what day of coronavirus quarantine. Thought it was Thursday, turns out it's Friday, but anyway, I've had a few patients reach out to me and want to know what's something they could do for their immune system with all this going on. So, always the best things are good nutrition, good sleep, decrease your stress, get a little exercise. But it wouldn't be me if I didn't have just a little something extra for you, and it wouldn't be me if it didn't start with a little anatomy lesson. So here we go. All right, so we've got the stomach going into the small intestine, not pictured here for space purposes. These red lines are what we're going to be working with. This is a greater omentum, and then ascending transverse descending colon, spleen, it should be a little closer, but let's not get too picky. So this greater omentum houses a lot of your lymphatics and immune system, your lymphocytes, your B cells, your T cells, which kind of find the virus and bacteria, get the cascade in motion. Macrophages, which are these little cells that just kind of engulf cells and eat them through a process called phagocytosis. And the whole kind of apron, it goes down and folds back up on itself, migrates towards areas that are inflamed, so they could do their work more concentrated in that area. So again, as you can see, it just kind of hangs off the bottom of the stomach. Stomach is more on your left side, does hang down. So that's what we'll be talking about. I struggled with, should I even make this video? This is a technique that very good therapists train their hands many years to be able to feel subtle nuances and do. So I thought no, then I thought we're in a pandemic, so let's roll with it. That being said, if you have or suspect you have any internal hemorrhaging, low platelet counts, if you have any hernias, either repaired or non, any foreign bodies, including mesh, IUDs even, don't do this. Do those 4 other things I mentioned at the top. All right. Also, it's really hard to assess the tissue from standing, because if you're standing well, you should use postural, should have your abdominals on posturally. So I'm going to sit. You could also do this lying down with your knees a little bit on slack so that you can get into the tissue. And we're talking about a 20% depth in your body here. So I'm just going to kind of relax the abs, get in there, work on all different angles. Scoot over a little bit. Try those different angles. I feel one right there. And that's going a little bit down in this direction. So I'm just going to move my body in the opposite direction. So with my hands here, kind of pulling the slack of that restriction down towards my left thigh a little bit. And then don't have to go far to feel that stretch pull on. And up into the right, and just holding here. Watching this happen is about as exciting as watching paint dry. But if you're stuck at home, it might be the most exciting thing you see all day. And then so when that tissue begins to go a little bit, you can either take up more slack in that down position and try to get up a little higher into it, hold that again. You can layer a little deep breathing onto it, but if you breathe too deep, you might push yourself out of that spot, and you don't want to do that. There we go. And let's see, I know from earlier I had another little spot. And further right here. Kind of going down in this position, so I'm just going to bring my body up in the opposite direction. right there. Again, this is just to improve the mobility of the greater omentum, which houses all those nice white blood cells ready to fight infection. Increase the blood flow to it, just make sure it's functioning at its optimum. I'm going to go a little more here. And while no, there are no studies for this specifically to coronavirus, and I do not have any, there we go. Advanced degrees in immunology, like I said, it's just something some patients have been asking me about and what I'm doing for myself. So good luck with all this, and I'll see you on the flip side, Oconomowoc. Good night.